Hello, good afternoon or good morning, depending on where you are. I'm Barbara Gottlieb, the Director of Environment and Health in the National Office of Physicians for Social Responsibility. And it's my pleasure to welcome you to our webinar today, Cooking with Gas, Health Harms from Gas Stoves. This is our first public presentation of a new PSR training series in which we expose the harmful air pollutants produced by the gas stoves that so many of us, frankly, have in our kitchens. Their negative impacts on the human body, their exacerbated impacts on vulnerable populations, and how health professionals can help their patients reduce their risk. This training is part of PSR's ongoing education and advocacy concerning the harms caused by the extraction, transport, and combustion of fossil fuels. In this case, methane, which is sold to us under the name of natural gas, although I think unnatural might be a better term. This is also part of PSR's campaign to replace gas stoves with a much cleaner, safer, and highly efficient electric alternative that you'll hear about in the course of our webinar. There's also a corresponding effort to replace gas furnaces with a much cleaner, safer, highly efficient electric alternative known as heat pumps. And you'll hear a little bit more about that and our work on building electrification later in the webinar. But most of all, we'll be focusing today on the health harms associated with gas stoves. And for that purpose, we'll be hearing from my colleague, Zach Williams. Zach is the health educator in the Environment and Health program. He joined our staff this fall, and I have to say, I am so glad he joined us. Zach, who has a master's in public health, is going to be offering this and similar trainings on gas stoves to health professionals all across the country. I'm pleased to say that we're able to offer continuing medical education credit for those trainings, and shortly we'll be offering continuing education units for nurses as well. CME credit is offered for today's training. For those of you who are physicians, you'll hear more about that from Zach. So let's go to the training. Before we move on, let me just mention that if you have questions during the training, please type them into the question box in the bar at the bottom of your screen. Not into the chat because we won't be monitoring the chat for questions, but into the question box. We are definitely reserving plenty of time for questions at the end of the training, so we'll get to your questions then. Could we have the next slide, please? For any of you who don't know us, we are Physicians for Social Responsibility, protecting human beings from the greatest threats to health and survival. We consider those threats to be, first and from PSR's founding, nuclear war, always and once again a real concern in our world. And also, besides nuclear war, one of the greatest threats to health and survival is climate change. And it's really with climate change in mind that we are focusing so much on methane gas. PSR is a national nonprofit founded by physicians more than 50 years ago. We have about 33,000 members. We were the winners of the Nobel Peace Prize in 1985 for work having to do with nuclear disarmament. PSR mobilizes physicians and other health professionals to advocate for climate solutions and for a nuclear weapons-free world. And we contribute the health voice, ours and yours, to energy, environmental health, and nuclear weapons policy at the local, federal, and international level. I think we're ready to start talking about stoves. Let's see our next slide, and Zach, take it away.
You bet. Thank you so much, Barb, for that wonderful introduction. Hello, everyone. My name is Zach Williams. I'm a health educator and campaign coordinator at the Environment and Health program in the PSR National Office. And thanks so much for joining our training today. So I wanted to give a brief overview of what exactly you'll be learning today. So here are our learning objectives. By the end of this training, you'll be able to articulate how cooking with gas appliances produces dangerous indoor air pollution and explain the health effects of each pollutant, recognize and prioritize vulnerable populations, as well as understand why they are vulnerable, and address the health effects of gas stove pollution and explain to patients the steps they can take to reduce their risk. Before we jump right in, I do have some housekeeping to do, some admin. Here is our accreditation. We are partnering with USF Health to provide our CME credits. I won't read this huge big paragraph. It is a lot of legalese to say that we are indeed CME accredited. Next is our disclosure that we promise we are not selling you anything. We have no relevant financial relationships to anything we talk about in this training. So really quick, before we jump into the content, I do want everyone to take this short pre-test. Now, if you have a smartphone, you can open the camera app and hold it up to your screen and scan that QR code. And if you don't want to do that, I also just dropped the link into the chat as well to take this short pretest. It's only 5 or 6 questions. It should only take us about 3 minutes. So I'll start the clock now at 12:06 and we'll come back at 12:09 to continue with the presentation. And I'll pause our recording real quick. Thank you so much for taking that short pretest, and let's jump right in then. So before we get going, I have a question for the group. What's the first thing that comes to your mind when you think of gas stoves? This you can put into the chat. Don't put it in the Q&A function. This is more of a conversation that we're going to have. So what's the first thing that comes to mind? Toxic pollutants, flame, sure thing. Convenient, quick and easy, also true. Great at cooking. Toasting a corn tortilla, how appropriate, absolutely. Fracking, yep. Alrighty, great. Oh, and I also see I missed one, quick heat. There we go. Great, so thank you so much. It seems like we have a mix of both positive and negative connotations here, which is great. So it shows that, you know, there is this emotional tie we have to gas stoves. I think of the colloquialism cooking with gas. It's a positive connotation. You know, your car didn't start and then it did, and now you're cooking with gas. But as you'll learn through the course of these next 45 minutes, that may not be the case. So let's jump right into it. No matter how you feel about gas stoves, the fact remains that using a gas stove without ventilation produces dangerous indoor air pollution. This leads us to the first section of the training, which is understanding the pollutants produced by gas stoves and the health effects they have on the human body. The primary pollutants produced by gas stoves include nitrogen dioxide, carbon monoxide, and particulate matter, both PM 2.5 and ultrafine particulate matter. Now, let's look at what these pollutants actually do to the human body. So let's start first with nitrogen dioxide. Nitrogen dioxide is a harmful air pollutant that is produced when combusting fossil fuels, including the methane we burn in our stoves. NO2 contributes to the development of asthma, aggravated asthma, and increased susceptibility of respiratory infections. It's also associated with negative general cognitive functioning. Next, let's talk about carbon monoxide. It's another dangerous gas and perhaps more well-known than nitrogen dioxide. Exposure to carbon monoxide can have neurological effects such as fatigue, impaired vision, dizziness, all the way to falling into a coma. And for cardiac patients, carbon monoxide can also cause chest pain. And at high enough levels or long enough exposures, carbon monoxide can also lead to death. Lastly, is particulate matter 2.5 and ultrafine particulate matter. PM 2.5 stands for any matter that is smaller than 2.5 microns. And for context, 2.5 microns is smaller than the width of a human hair. It is an incredibly, incredibly small molecule, and ultrafine particulate matter is also any particulate matter that is smaller than PM 2.5. So it's small enough to get into our lungs, into our alveoli, and then pass into our circulatory system. So it's an incredibly dangerous form of air pollution. PM 2.5 can aggravate asthma, can decrease lung function, and increase respiratory symptoms. It can also contribute to non-fatal heart attacks, irregular heartbeat, and premature death in people with heart or lung conditions. PM 2.5 has an asterisk next to it because this pollution varies based on the type of food that's being cooked. PM 2.5 is produced by gas stoves without food being cooked, but it dramatically increases when there is food being cooked on the stovetop, particularly fats and oils. So let's move on now to look at the exposure and how much of these pollutants that we're actually being exposed to. So gas stoves produce so much NO2 that their indoor emissions often exceed outdoor standards. On the left here, you will see the national standards and guidelines related to NO2 concentrations. The United States does not have standards for indoor air pollution, so we use the outdoor standards as a reference. The US EPA national standard is 100 parts per billion, and the World Health Organization's indoor standard is outdoor standard, I should say, is 106 parts per billion. For context, 1 part per billion is like adding a single drop into an Olympic-sized swimming pool. It is, again, a very, very small amount. Now, data from the Lawrence Berkeley National Laboratory shows that in houses that are less than 1,500 square feet, indoor air levels of nitrous oxides exceeded EPA ambient air standards more than 83% of the time when people cooked with gas stoves without ventilation. And that goes up to 100% of the time when the home is smaller than 1,000 square feet. From these data, we can see that using gas stoves without ventilation produces dangerous levels of air pollution. But let's look at this visually to actually see what's going on. So this is a graph pulled from that Lawrence Berkeley National Laboratory study. The y-axis shows NO2 concentration and the x-axis shows time. Here, the red line shows NO2 concentration measured in a kitchen, and the blue line shows NO2 measured in a bedroom. This house where they were measuring these air pollutant levels had a gas stove and did not have proper ventilation. So as we can see, when they tested each of these cooking functions throughout the day for about an hour, you can see that here is 100 parts per billion, which is the EPA standard. You should not be around NO2 higher than 100 parts per billion for longer than an hour. And as you can see, every time the gas appliance was used to cook, the levels of NO2 were easily over 100 parts per billion for about an hour. So this shows that, yes, indeed, these air pollutants are being produced at dangerous enough levels from these gas appliances. But let's now connect that to the dangerous levels of air pollution actually causing some adverse effects on human health. So here is another case study. This is a study entitled Association of Changes in Air Quality with Incident Asthma in Children in California, 1993 to 2014. This is a multi-level longitudinal cohort study done in 3 waves in Southern California, which essentially means it's one of the best research methods that we have to show the effect on NO2 and childhood asthma. Here we see each of these lines is its own separate community, as you can see in this key right here. On the y-axis, we have asthma incidence rate, so how much children are getting asthma. And on the x-axis, you can see it's inverted. Higher NO2 concentration over here, lower NO2 concentration over here. And as you can see, as NO2 concentration decreases, so does the rate of incident childhood asthma. So you can see when you lower NO2, you also lower the amount of childhood asthma that you see. Because Los Angeles took some steps to deal with their smog problem very seriously and took important steps to clean up their air, they made the city safer and healthier for Los Angeles's youngest populations. And the focus here on children is important as we transition to the next slide, because children are one of our vulnerable populations when it comes to gas stove pollution. Children are more susceptible to air pollution and are one of the most vulnerable populations to gas stove pollution for a couple of reasons. 1, they have an increased breath rate. 2, they have higher lung to body ratios. They have higher lung surface to body weight ratios and smaller bodies. So the NO2 concentration that could be safe for an adult is actually dangerous and harmful to a child. And they also have developing immune and respiratory symptoms, so they might not have the ability to deal with stressors in the same way that adults can. Now, when looking at the soup of pollutants that come out of gas stoves, which is NO2, CO, particulate matter, some formaldehyde, and some other lower concentration pollutants, as opposed to NO2 alone, that mix isn't well understood, but there is a meta-analysis that shows that this mix compared to NO2 alone, in homes with gas stoves, with children with no ventilation, there's a 42% increased risk of experiencing asthma symptoms. There's a 24% increased risk of ever being diagnosed with asthma, and overall a 32% increased risk of both current and lifetime asthma. Essentially, the big picture here is that this suggests that the multiple pollutants that come from burning gas together poses a higher risk to children than just NO2 alone. Now, I don't want to just focus on children when we talk about vulnerable populations, and I want to talk about a key important aspect here, which is going to be environmental justice. There are health disparities here at work, and let's zoom in and use childhood asthma as an example of this in terms of gas stoves. So not every child is going to be equally exposed to gas stove pollutants, and thus the distribution of childhood asthma is skewed. The data that I'm about to show you comes from the National Center of Environmental Health and the Journal of Urban Health. I won't go through each prevalence data point, but as you can see from the numbers on the slide that I'm about to put up, in terms of housing type, 21.8% of children living in public housing have asthma, compared to only 7.38% of children living in private residences. In terms of race and ethnicity, the prevalence of asthma in Puerto Rican children is almost twice that of white children, and the prevalence of asthma in Black children is more than twice that of white children. Lastly, looking at income level, 11.8% of children living below the poverty rate deal with asthma, as compared to just 5.9% of children that are at 450% of the federal poverty level. So living in a non-private dwelling, being Black, and living below the federal poverty level are all risk factors for childhood asthma, one of the most prominent health effects of gas stove use. But why is this? And I would like to delve a little bit deeper into the historical context of why these health disparities exist. So to fully understand this, let's take a look now at federal and housing transportation policies that essentially codified racism into the economic and geographic development of the United States in the mid-20th century. The Federal Housing Act of 1949 authorized the demolition of Black neighborhoods. And secondly, the Federal Highway Act of 1956 authorized the demolition of urban neighborhoods and replaced them with the nascent interstate highway system. This not only severed communities, which were most often Black neighborhoods, but also constructed long-term polluting transportation infrastructure next to, near, or simply through communities of color and low-income communities. Secondly, although it's outlawed today, many majority Black neighborhoods are still reeling from the effects of redlining. For those who don't know, redlining is a homeowner's loan corporation categorization strategy, where some neighborhoods were labeled as high risk, whose residents should not be given access to mortgages. These neighborhoods were outlined in red on their maps, which is where the term redlining comes from. However, today, redlining now refers to lending discrimination that bases credit decisions on the location of a property to the exclusion of characteristics of the borrower or property. Redlining prevented investments in infrastructure, green space, public transportation, business development, and all other aspects of city planning that make for a successful and prosperous neighborhood. Because banks refused to give loans to Black Americans decades ago, their descendants now deal with increased levels of air pollution and a lack of political will to competently and systematically address these issues. Now, I want to delve even deeper into environmental justice because it is not just a racial issue, it is also a class and socioeconomic issue. So lower income households are at a higher risk of being exposed to higher levels of gas stove pollution. And why is this? So smaller unit sizes for one. It's important to remember that homes that are less than 1,000 square feet exceed outdoor NO2 standards 100% of the time if they do not use ventilation while cooking. Along with smaller unit sizes, there are also usually more people per home than higher income households. This means one, more people are using the kitchen, more people are using the appliances, and two, more people are getting exposed to the air pollution. Next, lower income families also are more likely to live in older homes and have less control over the maintenance of their appliances. Older homes may have gas stoves that haven't been properly adjusted or have pilot lights and are more likely to have inadequate ventilation over the stove. Having a cooking appliance with a pilot light means that there is methane burning in the home constantly at any given point, because that pilot light is there for when you decide at 2 a.m. to make a little midnight snack that you can turn it on and it'll be available. However, that convenience comes with the fact that air pollution is being pumped into your home at any given hour of the day. Next, low-income homes are also more likely to use stoves and ovens for heat. Homes with inadequate ventilation, poor landlord management, and poor insulation make families in these situations turn to the most readily available source for heat for relief from the cold. Their kitchen ovens, which is convenient and it's heating the home and provides relief, but it is also pumping the home full of air pollutants to get relief from the cold. Next, low-income households are also more likely to have higher exposure to air pollution. As we just talked about the Federal Highway Act, low-income folks often live near these undesirable neighborhoods next to large transportation infrastructure, but also water treatment plants, distribution facilities, waste treatment plants, any kind of large polluting infrastructure that higher income families don't want to live next to, low-income families typically do, which means they have higher exposure to air pollution. Lastly, low-income families are more likely to have a greater asthma burden for all of the reasons that I just spoke about. And having a higher asthma burden also makes them more sensitive to lower levels of NO2 and other gas stove pollutants. So I know I just threw a lot of kind of depressing information at you, but before we get to the solutions of how we can fix this, I have another question to pose to the group. Again, just throw it into the chat. Have you seen any of these issues in your patients? And if you're not a health professional and you don't see patients, think about in your family, your friends, your loved ones. Have you ever seen any kind of health effects that come from using gas appliances in your personal life or your professional life? You can throw them in the chat. Absolutely, these health effects are prominent in Michigan. Yes, absolutely. So we have seen some of these health effects in our lives. Great, thank you everyone. So, oh, there we go. Just got a flurry of them. Yes, I stopped having asthma attacks after we stopped using our gas heater. Imagine that. Not sure, hard to differentiate one cause from the other. Also a wonderful point. There are a bunch of confounders here. Is it the outdoor air pollution coming in? Is it a space heater? Is it, you know, your building in general, not your apartment? All good answers to this question. Most of the clients I have electric stoves. Great, amazing. Make sure they keep their electric stove. Alrighty, so let's go on now to the chunk and the meat and potatoes of this training, which is the solutions, of course. Never present a problem without a solution. So to properly address this complex health issue, the solution should be, I should say, multifaceted and systematic. First and foremost, the solution should address the target health effects the patients are experiencing and be within feasible and correct medical practice. Ideally, the solution should also incorporate and acknowledge the living environment of the target population and should aim to improve the quality of that environment. The intersection of these three core aspects is the ideal, perfect situation. However, we live in reality where things are hardly ever perfect. So to that end, let's explore some of these possible solutions that can mitigate the negative health effects of combusting fossil fuels in the home. First, just like any other medical issue, let's talk about risk assessment. So while you're in the room with a patient, you can begin with risk assessment. Are they a part of a vulnerable population? And we've talked about a couple already, but these vulnerable populations can include children, the elderly, the people living with diabetes, those of low socioeconomic status, people living with obesity, and people living with pre-existing heart and lung conditions. If you are in the room with a patient and they belong to one of these vulnerable populations, might tick off a light bulb to think about gas stove pollution. Next, what about some lifestyle or behavioral risks? You know, what are their hobbies? Do they run outside? Are they exerting a lot of energy whilst around air pollution outside? Do they even use or have access to ventilation in their home when they cook? Do they smoke? Do they use fossil fuels inside the home? Do they have a gas appliance, a gas stove, a gas heater? What is their time spent in heavy traffic, and what are their in-car behaviors that would make them have higher exposure to air pollution? And do they live near an industrial or a fracking site? Just like we said before, all things that contribute to higher exposure to air pollution and could exacerbate these issues. Next, once you've assessed their risk to see if they are high at risk for gas stove pollution, then we can go to risk management. Pardon me, it's a little spoiler for what's about to come up. But first and foremost, when talking about risk management, let's think about the patient level. So first and foremost, you should address the health conditions that the patient is experiencing. If it's a child that is wheezing and has asthma symptoms and they don't have an inhaler, get them an inhaler. If they don't have, albuterol or something like that to deal with to mitigate their symptoms and to prevent them, get them that as well. But also consider that exposure to pollutants is a risk multiplier. So if you have a patient that does have asthma, it will be exacerbated by the pollutants that come from these gas stoves. And also I want to keep in mind this vague symptomology when we talk about gas stove pollution, like fatigue, headaches, sinus congestion, cough. This can be caused by low levels of exposure to carbon monoxide and other volatile organic compounds. So it might not be just a cold, might not be just allergies. It could be something to deal with carbon monoxide and gas stove pollution. When you're not in the room with a patient, you can join, or if you already joined, urge your state medical societies and medical specialty societies to formally recognize the risk to health of asthmatic children when cooking with gas. The societies you're a part of should work to raise awareness among doctors and nurses by developing and distributing guidance and intervention recommendations, because raising your voice is one of the most powerful acts health professionals can do as trusted members of their community. As an example, the American Medical Association recognizes this, and their climate change policy adopted in 2019 recognizes the importance of physician involvement in policymaking and encourages physicians to act as role models for sustainability. Calling out and bringing up the health effects of gas stoves is absolutely a part of sustainability to reduce our reliance on so-called natural gas. Lastly, you can contact your local county or state legislators and ask them about any current electrification bills or policies that are on the table for this legislative season. Supporting these legislative electrification efforts as a health professional will add needed weight to the movement and hopefully start to push these legislators to start to pass some policies regarding building electrification. Now, apart from this high level, you as a doctor, you as a policy person, what can you do as an individual, or what can you tell your patients to do as an individual to reduce their risk of gas stove pollution? So here's a wonderful slide that summarizes all of the steps you can take, and let's go by them one by one. First and foremost, you can install and maintain a carbon monoxide detector in your kitchen. Now, there is a PSR member that definitely would urge me to tell you that not all carbon monoxide detectors are made equal. Most of the carbon monoxide detectors that people have only go off when the levels are dangerous enough for death at fatal levels. So you do want to make sure that if you do want to buy and install a carbon monoxide detector, make sure it's one that can recognize carbon monoxide at low levels as opposed to fatal levels. Next, if it's available, run your exhaust hood while you're cooking. Turn on that fan above your stove while you're cooking and while the gas stove is on. Now, if your vent is like mine in my kitchen, I do not have an exhaust hood that goes outside. I simply have a fan in my microwave that blows the air over my head. Now, that's not perfect, but it does get the air circulating enough that it can maybe go near a window and escape your kitchen as opposed to just holding and staying in your kitchen. Next, like I just said, you could open a window. It's one of my favorite solutions. It's free 99, my favorite price. If you open a window, again, it's not perfect. It's not going to be like a ventilation hood, but it causes air circulation and a way for the air pollution to get to leave your home. Next, you can cook on the back burners, and this might not be intuitive. I didn't really understand what was going on when I first saw this, but cooking on the back burners, even though it's physically farther away from you, which might be a little annoying, the pollution that comes off that burner and that hot pan or pot will be more likely to hit your exhaust or ventilation hood if it is on the back burner. If it's on the front burner, it's much more likely to spill into your kitchen or your home as opposed to being caught by the ventilation hood. Next, you could use electric appliances like toaster ovens, kettles, or air fryers, any kind of plug-in appliance to reduce the use of your stove, your gas stove, or your gas oven. You could also try a plug-in induction burner. These are great if you want to stop using your stovetop entirely, if it's gas. They're, they cost a little bit of money. The single burners are around 60 bucks, and the double burners are a little over 100 on Amazon. But this is a great way to reduce your gas stove use entirely. But if you do want to get at the root cause of this issue, it's switching to an electric or an induction stove entirely, taking out that gas oven, gas stove, and replacing it with an induction stove. To give a little spotlight to induction stoves, let's switch to the next slide. Now, I know people may have horror stories in their minds about electric stoves. Maybe you think of those like mid 20th century resistance coil electric stoves. Don't really work that well, takes 84 minutes to boil water, but we're in the 20th century now, and there have been some wonderful technological improvements to electric stoves, like induction. So let's talk about induction stove real quick. These appliances are high-tech and work completely off of electricity, so there is no fossil fuel pollution inside your home when you use an induction stovetop. Now, it works off electricity, and most of our electricity in the United States is generated by the combustion of fossil fuels. So I'm not saying that there's no fossil fuel pollution, but there's no fossil fuel pollution inside your home, in your kitchen, when you're using an induction stove. Next, it lowers the household accident risk, as it does not produce combustible gas, and only the pot or the pan gets hot. This is because induction stovetops work through magnetism, as opposed to the traditional electrical resistance that electrical stoves used to work off of. Now, that's not a guarantee that your child might not, grab a hot stove and burn themselves, but that's certainly safer than the entire appliance getting dangerously hot, as opposed to just the cookware that you are cooking with. Lastly, it's an investment in your family's health. I know not everyone is made of money, and especially during COVID, many people have fallen on hard times, and replacing an entire appliance might not even be high on the financial priority list, and it might not even be possible if you're renting your home or your apartment. However, just like I said before, these single unit plug-in induction burners, they go for around 60 bucks. And if someone's child is having a hard time breathing at home, increasing induction stovetop use and decreasing gas stove use can provide some relief, while larger scale, longer term systematic work is done to decrease air pollution in their neighborhood and their home in general. Now, let's talk about something that is being touted as a solution, but it certainly is not. And this is also an opportunity for physicians to use their voice to stop something that is being touted as a solution. Let's talk about hydrogen blending. So this is coming down the pipeline. I won't spend a lot of time on this, but it's just a heads up that if you hear about this, it's a good opportunity to raise your voice as a doctor, as any kind of health professional, to say, this is not great. First of all, it's not great for the climate. To produce and get hydrogen, you need to do a process called hydrolysis, which is an incredibly energy intensive process, essentially. It requires a lot of carbon to be burned to acquire hydrogen. Now, there is something called green hydrogen, which is produced by renewable energy electricity, and that is a 0.1% of the production of hydrogen. So producing hydrogen is bad for the climate. It's more explosive than methane, so it's more dangerous in terms of combustibility. And when you combine methane and hydrogen and combust it, it actually produces more NO2 than just methane alone. So it increases all of those gas stove pollutants that we were talking about before in the beginning, causing increased levels of childhood asthma. So it's not better for the climate. It's not better for us. Let's not allow it in our kitchens. Now, this is part of a larger effort that PSR is working on called Building Electrification. And I will pass it to Barb to speak about PSR's work for building electrification.
Thank you, Zach. As I mentioned at the very introduction, the work that we're doing on gas stoves is part of something larger than itself. And it actually fits into a movement that is known as building electrification, or sometimes as building decarbonization. The idea here is that both your health inside your home and in your kitchen as well as the larger health of the planet, is going to be vastly improved if we can stop burning fossil fuels. So yes, it's true in the kitchen, and it's also true in terms of impacts on the climate. Remember that most of the that what you burn in a gas stove is methane. It's natural gas, if you will. It's fracked gas, and it is an extremely powerful climate accelerator, climate change accelerator, because it holds in so much more heat than even does carbon dioxide. So PSR is working across the country to help local jurisdictions stop the increase in the use of gas by actually banning the construction of more gas connections to buildings, and rather proposing that new buildings be built that are all electric. As Zach mentioned, we see electricity being generated more and more from clean, healthy, renewable sources. Not all of it is yet, so this is not a magic bullet. This is not a snap your finger solution. But what we're doing is building the way towards the future and creating the demand for the renewable energy that we know will be coming. So you see on this slide highlights from 4 of the chapters within PSR that are working to promote building electrification where they're located. These aren't all of the chapters that are working on it, but we thought rather than burden you with an overpower slide, just give you a few highlights from Washington State. A number of cities and towns are actually changing their building codes to restrict the installation of new gas connections in new buildings, specifically commercial buildings there, or large apartment buildings. PSR Colorado took a very different approach, and they created a television public service ad about the dangers of gas stoves and also gas furnaces, the kind of information Zach is sharing with you today. And it was run on NBC News. In Boston, the Greater Boston PSR chapter helped the local, or I should say the state medical society, the Massachusetts Medical Society, pass a resolution recognizing and acknowledging the association between the use of gas stoves and incidents of asthma. And then in Pennsylvania, the Pennsylvania chapter of PSR is encouraging and helping low-income households participate in home rehabilitation programs that help with the electric transition. And some of these programs are actually specifically providing replacements to gas stoves. So there are things that can be done, and PSR is very involved in doing them. Next slide, please. So with that being said, I think that most of the people on this presentation today are already members of PSR, but if you're not, join us and help to build this really important movement for personal health and for climate health. Go to www.psr.org for more information about how to become a member. And then you can sign up to receive information and action alerts by becoming an e-activist. And Zach has just put that particular link into the chat. And then finally, for those of you who want to take more demanding, and I would say also more effective action, we have a core group called Climate Ambassadors, who from the national office receive information every month about significant actions they can take. This could be writing a letter to the editor, it could be writing an op-ed for your local newspaper. It could be calling your senator or representative. It could be participating in a remote visit with your senator or representative's office. It could be testifying before the EPA. We promote these actions, we propose these actions, and we help you take them out. So if you'd like to become a climate ambassador, Zach, thanks again. Zach has also put that link into the chat. So why don't, if you'll take a look at those options for taking action. While you do that, I'm going to start helping us pepper Zach with questions. We have a number of questions that have been put into the question and answer box. Thank you for doing that. I was also trying to keep up with the chat while Zach was talking, so I have questions from both sources. And let's begin with this. It says, thank you for the excellent presentation. Can you please briefly describe the physics of producing heat through magnetism, and do these stoves work with all kinds of pots and pans? Zach, you're not a physics major and neither was I, but let's see between the two of us what we can do with this question.
Sure thing. So I was just about to preface that I am not a magnetism physicist, but from what I can gather from the induction stoves is that the stove itself is creating a magnetic field by moving particles in the burner. And that then creates an opposite charge in the pot or the pan, which generates heat as opposed to generating heat through a resistance electrical current in traditional electric stoves, which then heats the pot or pan through conduction. The magnetism and the exact specifics of the physics, I'm so sorry, I do not know. But I would assume that, well, you never want to assume, I would think that because induction stovetops are also used in some commercial and retail kitchens as well, I would think that most cookware would be appropriate to use with induction stovetops.
I'd like to jump in on that. First of all, I can add one sentence to Zach's explanation of the mechanism here. My understanding is that the magnetic impulse which moves through the cookware encounters resistance, and it's the resistance from the metal of the pot to the magnetic wave that actually generates heat. And it's not true that all kinds of pots and pans can operate with an induction stove. It has to be one that conducts magnetism. So if you have a magnet lying around, hold it to your pots and pans and see if it gloms on. Certainly, of course, if you've got one of those great old iron cast iron pots, that's going to be a definite yes. And some metals will and some metals won't. I think that the ones that won't work most definitely that many people have are those that have a Teflon style coating. It may no longer be Teflon. I hope you've done away with your Teflon pans because they can emit dangerous fumes when heated to a high temperature. But the I guess plasticized, or I don't know what that material is covering, those are the pots and pans that cannot be used with an induction stove. And let's just acknowledge for a moment that that is a problem for a lot of households. It's one of the things that unfortunately undercuts the benefits to low-income households of using induction stoves. I mean, induction stoves are highly energy efficient, and so it can actually help you reduce your energy load. But for some people, the prospect of having to throw out all your pots and pans and go to the store and buy new ones, that's a barrier. Here's another question, Zach. This says, my gas fireplace has a pilot light that seems to be always on. Is that putting out a lot of NO2, nitrogen dioxide, or only when it is turned on? And are there gas fireplaces that operate without pilot lights?
So I'm going to say for the gas fireplace pilot light, it is probably not as much NO2 as when you turn on an entire burner for a gas stove or when you turn on that gas oven. The pilot light isn't producing a ton of NO2, but it's non-negligible. I think there is enough air pollutants coming from that pilot light that you can probably measure it. In terms of are there fireplaces that don't have pilot lights? I'm so sorry, I am not a home retailer and I do not know if there are gas fireplaces without pilot lights, but definitely something to look into. Thank you for bringing that up.
Yeah. I just actually want to echo the thank you for bringing it up, because we have been talking just about gas stoves today, but let's certainly acknowledge that there are other gas appliances in our homes that burn gas and to a greater or a lesser extent are also putting these same pollutants into our homes. I say greater or lesser because the real big gas burner is, if you have one, it's your gas furnace. The reason that we focus on the stove and not the furnace is that gas furnaces are built to be vented outdoors. So although they create pollutants, they should not be significantly increasing if they're working properly, if they're properly vented. They should not be significantly increasing the pollution levels inside your home. I can't say the same about the gas fireplace. The gas fireplace it's almost like an open fire in your home that's burning gas, and I would say that's problematic. I got some very helpful tips in the chat that complete a little bit my would-be answer about pots and pans from Dr. Richard Tolan. Pans that are made with stainless steel and iron, like the cast iron I mentioned, are magnetic. Porcelain pans won't work. And Mark Dian adds, aluminum pots and pans also will not work on induction stove tops. Okay, let's turn to another question. There's a lot of material and embedded energy in a gas stove. Should we just throw them away, or is there a way to recycle them in part or whole?
I would say anytime you are getting rid of quite literally anything in your home, recycling should be the top of the priority list when it comes to waste management. So I would say probably look for any kind of scrap metal, what am I thinking of? Stockpile, the dump. I don't want to say dump, but any kind of recycler that is looking for any kind of scrap metal might be a great way to deal with this. I know there's some organizations, pardon me, I live in New York City. There are some organizations in New York City that will come to your place of residence and pick up kind of these larger scale home recyclables or junk. So I don't know the specifics, but I would definitely looking into recycling an appliance is great and also sustainable for the environment and helps us with the circular economy.
Thanks for that, Zach. Here's another one. Do you have materials clinicians can use to educate asthma patients about risks from gas stoves?
Thank you so much for bringing that up. One comes to mind. The San Francisco Bay chapter is in the process of developing a wonderful brochure that is patient-facing that deals with the health effects of gas stoves, particularly of NO2. So there are some materials being produced by the San Francisco Bay chapter. It's one of our initiatives that we are looking forward towards in this program as well, to develop some fact sheets and some graphics for anyone that comes to these trainings. So be on the lookout for those. And if you are interested, I think I saw the San Francisco Bay chapter in this chat. So if they're willing to share their brochure, that'd be lovely as well.
Thank you, Zach. And let me just add that once that brochure is produced by our San Francisco Bay PSR chapter, and also as we in the National Office of PSR develop more materials, we will be posting them at www.psr.org. So stay tuned and keep checking periodically. Here are two questions. They were proposed separately, but I think they might be related to each other. One is, what percentage of low-income households versus high-income households have gas ranges? And then what can be done to help low-income households replace their stoves?
So that specific data point statistic, low income versus high income with gas stoves, I don't have an exact number and I don't want to lie to you all. My thinking would be that it might depend on the region that you are in. For example, the South is pretty much electric stove country. The South typically uses electric stoves. The Northeast in Vermont and Maine uses propane. But elsewhere in the country, they do use gas stoves. I think the statistic is about 1/3 of homes in the United States use gas stoves. Now, the discrepancy between low income and high income homes, that's an interesting data point to find. And thank you for bringing that up. I'll look into that because I think we see gas stoves as this prestige. I finally made it. Look at this pretty gas stove I have in my kitchen. But we need to transition that to an induction stovetop, which is also a little maybe prohibitively expensive for lower income households to have. So that specific data point, don't know. Thank you for bringing that up. I'll look that up. Now, in terms of things we can do or available services to help low-income folks replace their gas stove. Barb just talked about something that the PSR Pennsylvania chapter is doing, where there are home rehabilitation programs that are specifically geared towards low-income homes that help with the electric transition. So this would be helping folks with the money to replace their gas heater with a heat pump, replace their gas stove with an electric stove, essentially replacing the gas appliances with electric appliances. Local, probably city or county run programs like that would be the best option. And I'm thinking more so of like green grants or any kind of home rehabilitation program that's available locally in your city or county.
Thank you, Zach. I must say that I've gotten a number more corrections on my statements concerning cookware, and I'm going to share them with you. But even before I do that, I want to acknowledge that, Zach, you were saying we have to make this transition from the gas stove being the prestige item to the induction cooktop being the desired item to have in your kitchen. I think from the amount of information that we're getting from our audience, that indicates that a lot of people on this presentation have already reached that point and can become very valuable proponents, I think, of this whole electrification transition. So Maria Bartlett from Andover, Massachusetts says it must be stainless steel, use a magnet to tell, that's right. And she also says that I was incorrect about the nonstick surfaces. You can get nonstick, I guess, pots and pans that will work with induction. I'm delighted to hear that. And then somebody, this was an anonymous attendee, said, I recently found out that none of my cookware would work on an induction stove except the cast iron skillet. This is not helping me to choose to replace the gas stove.
Which I have to admit is probably a reality of many folks here. And like we said in the beginning, this is not a silver bullet, magic, magic wand wave and everything is better. I think it's just about risk assessment for yourself and where you see the costs and benefits. The benefit of having healthy air in your kitchen, the cost of trying to replace your entire cookware set as opposed to just having a cast iron skillet. It's going to be a personal decision, and I biasly will say it's an investment in your home. Maybe find some cookware that would work with an induction stove. But I also know that I can't tell everyone to, buy something. Not everyone's made of money. But it's an important point to bring up that there is this tension and there is this conflict when it comes to what can be used on an induction stove. Folks, real quick, in the last 5 minutes, this has been a wonderful discussion, and thank you so much for all of your questions and all of your thoughts. If we didn't get to your question, feel free to email me at zwilliams@psr.org and we can talk offline and get your question answered. But in the last 5 minutes, I do just want to do some more admin. So if you do need these credits that this training is accredited for, you know how to find and access them. So I'm just going to pause. There we go. And now, everyone, thank you so much. It's been a wonderful, wonderful hour-long session we've had here today. I would just ask that at the end of this session, you complete this post test as well. You could either, again, scan it from your smartphone or click on this link in the chat as well. And apart from that, we've already done our question and answer. So I'd just like to say thank you so much and stay safe, everyone. It's been a wonderful time today. And yes, to answer your question, you will be able to access a recording of this webinar afterwards. We will be posting it on www.psr.org. So please look out for that as well. And if Zoom will allow me to access your contact information from the attendee list, I will also try my best to send us an email blast out to just attendees of this training with the recording as well. Any last comments, thoughts, feelings, hopes, and dreams? I'm seeing in the chat, well, one, thank you. You're very welcome. Thank you for coming to this training. And also, you need an account with USF to get credit. I do think that is true. So I think you do need to create an account with USF. Don't worry, they're not going to steal your email and sell it to someone, and then you're going to get spam emails. It's just so that you can access the credits for this ACCME accredited training. Appreciate the EJ focus. Thank you so much. We really wanted to make sure that environmental justice was a key facet of this training. Great. Okay, then with 2 minutes left on the clock, I'll give you back some time on your calendar. Thank you all so much for a wonderful, wonderful time today. And with that, I'll start the webinar. Thanks so much, everyone. Have a wonderful day.
Bye.